Hi guys, it is Brittany from My Core Floor, and I hope you guys are all having an awesome Friday. I thought I would jump on because this week in the My Core Floor membership, we are talking Kegel exercises, and Kegel exercises are one of my favorite things to talk about. So I thought, you know what, I'll jump on the page and into my free group and talk about it with everybody because it is such an important topic, and it's one that always comes up when I'm working with clients, either one-on-one and even in the membership. I've had people ask me, does your membership just talk about doing Kegels? I used to teach a pelvic floor class, and people would say, well, what do you do? Just have everybody come in and you all Kegel together? And I was like, gosh, no, it goes so much more beyond Kegel exercises. So it's always a fun topic to talk about. So who else out there feels like Kegel exercises are not doing it for them? They're not working. You've done them, you've tried them, but you're still having leaking. You still, have a few drops come out when you cough or you're laughing, or if you sneeze unexpectedly. Who else is dealing with prolapse issues where maybe you're having some vaginal pressure, or after having delivery of a child, your bladder has dropped down into the vaginal canal? Those are all things that doctors or things you read about in magazines, when you are looking for more information on those topics, you will see, do your Kegel exercises. It is such a common thing to hear and a common thing to read about as women. And so I love to talk about it because as a pelvic PT, I rarely teach Kegel exercises, which is usually shocking for most people. I learned about them when I was in, PT training and in programs to learn to be a pelvic PT. But it's really evolved in women's health over the years, at least from a physical therapy standpoint. So I love to get this information out there because while it's evolving in the physical therapy world, I find it's not evolving in the rest of the world, meaning that doctors are still prescribing them for women. People are still reading about them in magazines. And I feel like we're not hearing anything else other than to do Kegel exercises. So it's always a fun topic for me to jump on and talk about. So why not Kegels? Or why do they work for some people and they don't work for other people? And I am going to tell you why. So I have my trusty model here with me. And what I want to show you guys is if you look at the pelvic model. So here you are from the front. This is your pubic bone, and here's your spine in the back. And if I tip the pelvis so that you can look inside, you'll see what looks like a soup bowl of muscles, and that's your pelvic floor. So what is really cool about all these muscles is that because they're shaped like a bowl, the muscle fibers in that bowl actually run in different directions. So what that means is that some of the muscle fibers actually run more of kind of a vertical orientation, some run on a more horizontal orientation, and then some actually kind of wrap around. So the fibers change directions. So what that means is that in order for those muscle fibers to activate, and that's how a muscle works, is the fibers have to activate. There has to be a elongation and a contraction of the muscle. So I always use the bicep as an example because if you want to get a strong bicep, everybody knows you start doing curls. The reason a curl is effective is that as you curl up, the muscle shortens, and as you curl down, the muscle lengthens. And as you go back and forth, it creates this accordion effect that will help to build muscle strength and muscle activation and turn on those muscle fibers. Same thing, guys, needs to happen with the pelvic floor. But because those fibers run in different directions, your hips and your pelvis and your spine have to actually move in different directions to get the blood flow, to get that activation of those pelvic floor muscles so that they can work for you. So that they can work for you to support your internal organs to help with prolapse. So they can work for you to shut off the urethra so that you don't leak those few drops when you're coughing, laughing, or sneezing. So that they can support the bladder itself just to give it better support to avoid urge incontinence or other leaking issues. Those fibers all have to be activated. What a Kegel exercise is it is a contraction of all of these muscles as one unit, okay? So the cool thing about the pelvic floor is that if my hands are the pelvis has to move forward and back to get the vertical muscles. Like I said, it's got to move side to side to get those fibers that run more lateral, and it's got to rotate to get those wraparound fibers. And then as a unit, those muscles will contract and relax, and that is a Kegel exercise. The other cool place that you can get that vertical kind of contract and relax like a Kegel exercise is actually with squats and with lunges. So as you go down in a squat or a lunge, the muscles will lengthen. And as you come out of that squat or lunge, the muscles will contract. So there's actually 4 ways to activate your pelvic floor. It is through the pelvis moving forward and back. It's through the pelvis moving side to side, and it's through the pelvis moving rotationally, as well as through the pelvis moving vertically. So if a Kegel exercise is just a vertical contraction of those pelvic floor muscles, you are only activating those pelvic floor muscles and fibers in 1/4 of the way that it needs to actually work to get full strength, full function, full activation, which means that a Kegel only does about 25% of what your pelvic floor needs and what your body needs in order to have good function, to avoid incontinence, to avoid prolapse issues. So it's the reason why for a lot of women that they say, oh, I've been doing my Kegels. I've done my Kegels. I've tried Kegels over the years. I've done ones where I hold it for 10 seconds. I've done quick, short ones where I hold it for 2 seconds. I do 100 of them. I do 10 of them. I do multiple of them multiple times a day. And it's the reason why for some women, they work. It is some activation of the pelvic floor. So if you move pretty well the rest of your body, that extra activation will help to strengthen your pelvic floor. But for a lot of women, we're actually stuck. Our pelvises don't move well in those other planes of motion. So no matter how good we are at that vertical plane, if we're not good in one of the other planes of motion, then our pelvic floor isn't going to function the way we need it to function. So how come, we know all this biomechanics, we know all of this needs to happen. So how come doctors are still recommending it? How come magazines are still writing about Kegel exercises? And so I've asked a couple of my friends who are doctors in the urology field, the GYN field, and what I have found out from them is, guys, doctors' hearts are in the right place. They want to help you have a better pelvic floor. They know that there is a muscular component to a lot of these pelvic floor dysfunctions, such as incontinence, such as prolapse, even pelvic pain issues. They know that there's a muscular piece. They just don't know what else to give you guys, because what some of the doctors have told me is that they actually didn't get any of this mechanics in school. They know there's muscles, but that's really not the focus when you're a doctor. It's the pharmacology, it's the surgery, it's the diagnostics. It's not the biomechanical piece of things. That's the job of the PTs. That's what we learn in PT school. That's what we learn is the biomechanics and the function through movement. And so I feel like there's got to be a better weaving and webbing of medical professionals so that you guys get what you need. But part of that is also you guys knowing what you need. So being able to ask your OBGYN or your urologist for a referral to pelvic PT. Being able to be an advocate for yourself, but also being able to say, you know what, if I don't have a pelvic PT in my area, jumping onto something like My Core Floor, getting into my free group, which is the Calling All Women. You'll find it down below here on the My Core Floor page. I give exercises every single week to help to improve pelvic floor function and turn your pelvic floor muscles on in all of those different planes of motion so that we activate all of the muscle fibers, not just that one vertical plane of motion that the Kegel exercise activates. So I love to talk about Kegels because I feel like it's something everybody knows about and everybody does, yet they're really super frustrated, and a lot of women do them and then just stop doing them because they feel like they don't work. I literally, guys, have had patients. I had one patient, which in my 20 years as a pelvic PT, who has still been to this day the patient with the strongest Kegel. She said, I do my Kegel exercises, but I still have leaking issues. I checked her Kegel, and sure enough, guys, it was like a suction cup. She literally could suction those pelvic floor muscles so super tight when I did her internal. And then she sat up on the table after I did her exam, and she peed all over the table. Because as soon as her pelvis started to move, her pelvic floor muscles didn't know how to activate. They could Kegel in isolation, but they didn't know how to work with the movement of the pelvis and the movement of the body. And that's usually, guys, where we have issues is if we're moving, we're trying to jump on the trampoline with our kids. We try to get up from a seated position and we leak a little bit. We go to jump or do jumping jacks, or we go to work out and we're having these issues. We have those issues with movement. So we need to learn how to activate our pelvic floor better with movement. And that's not just about doing Kegels with movement. It's about getting our pelvis to start moving better so that all of these muscles on the inside can actually start to activate and turn on the way that they're supposed to. So there's my chat on Kegels. And my other sidebar that I always like to talk about on Kegels is think about kids. When you guys are potty training your kids, you never teach them to Kegel. So you never sit down, you never show them the model, you don't teach them how to squeeze, but magically all kids potty train. And so why? What does a little kid look like that we don't as adults look like enough? They're jumping, they're running, they're moving. Their pelvises are all over the place, jumping up and down, twisting, turning, crawling. So those fibers are getting activated just through their movement patterns. As adults, what do we not do enough of? We don't move. We do a lot of sitting. We do a lot of locking our pelvis in place. If we've had pain issues over the years, pain in our spine, pain in our hips, we get afraid to move because we're afraid it's going to hurt. And that starts to shut our pelvic floor down over the years, combined with a whole lot of other things like estrogen and hormone changes. There's a lot of factors that can play in. But movement is what I have found is a key factor to improving pelvic floor function over the years as a pelvic PT. So there's your quick talk on Kegels for the day. If you guys want to know more, you're curious about what kind of exercises you can be doing besides Kegel exercises, if you're a woman, jump in the free group below. If you are a man watching this on my Facebook page and it turned up on your feed, let the women in your life, the ones that you love, know that they should check out My Core Floor Calling All Women. It's our Facebook group. I jump in every week talking about different exercises that will improve your pelvic floor. We don't ever really talk about any Kegel exercises other than talks like this, where we try to debunk and explain why Kegels are not the end all be all. So check it out. Hope you guys learned a little something. Hope it was a couple little tidbits of information for you guys on why your pelvic floor needs more than just that vertical Kegel contraction. Hope you guys are all staying safe and doing well, and that you have an awesome weekend coming up ahead. Have a great one, guys. Take care.